This segment is sponsored by PACE of Southwest Michigan.
I had the opportunity to talk with representatives from PACE of Southwest Michigan. Take a look. Well, here on Hometown Living this morning, we have PACE of Southwest Michigan. And here with us to share a little bit more information about PACE is Connie DiDonato. Connie, how are you this morning?
I'm good. How are you, Jackie?
I'm doing quite well. Well, just tell us, what is PACE?
Okay, so PACE stands for Program of All-Inclusive Care for the Elderly. And basically, it's an alternative to nursing home care. Our whole goal is to help people to be able to stay at home, living independently with our help so they don't have to live in a nursing home.
So who is PACE really for, and what kind of services do you provide to help those be able to stay living at home independently?
So the eligibility requirements for PACE are that people have to be 55 or over, live in Cass, Van Buren, and Berrien County, Michigan, although I know you have a lot of viewers in Indiana as well. So I'm going to say that there is also a PACE in Mishawaka that covers Mishawaka and South Bend. But our PACE of Southwest Michigan is for people who live in Berrien, Cass, and Van Buren counties. And they need to qualify for nursing home level of care. So that usually means that they are struggling with some kind of health issue that's jeopardizing their independence. So it may mean that they're having trouble getting around. It may mean that they're kind of forgetful. But basically it means that they are struggling to kind of achieve their normal tasks of daily living independently.
And what are the services that you really provide? What could someone thinking about taking advantages of PACE services really look for in your assistance?
So first of all, we provide primary care. We have a primary care clinic in our center in St. Joseph, Michigan. We have providers, doctors, nurses, and they're totally dedicated to our participants. They don't see anyone else outside of PACE. They're completely dedicated to our participants. We also provide home care. So a lot of people need help in the home. A lot of people might be forgetting to take their medications. We can help with that. Some people need help with meal preparation. Some people need help just getting up and getting out of bed and getting dressed in the morning. So it really depends on what they need. Some people need help cleaning, things like that. So home care is a huge part of what we do. We also, if someone needs a specialist, like a neurosurgeon or a orthopedic surgeon or a neurologist or any kind of specialist, we make that appointment for them. We get them there, so we provide the transportation, and we actually even pay for that appointment so people can see specialists as well. We also provide everybody's medication. They're delivered to the home once a month. We also provide physical and occupational therapy, which is huge. We focus on independence, like safety, fall prevention, things like that. And everybody is different. Everybody has different challenges and different abilities. So we assess them in the beginning, and then we offer the help that they will need individualized to their needs. We also have 2 registered dietitians, and we have a day center for socialization. A lot of people, especially right now, let's face it, are totally isolated. And how many seniors do you know who kind of sit at home and watch TV? So our center, we've got 4 or 5 different things going on every day. It's great for socialization. Obviously, currently, our center is closed because we're making sure to keep everybody safe. We don't want anyone catching the virus. But during this pandemic, we are calling people every day. We are still going to their homes if that's needed. We're providing them with crafts and things like that we can drop off at their house. So we're still keeping people occupied.
Well, also joining us from PACE this morning is Natalie Amicarelli. Natalie, how are you this morning?
I'm doing well, thank you. How are you?
I'm doing well. Well, as an intake coordinator, how do you help seniors and families navigate the enrollment process with PACE?
So I'm actually the go-to person from the time either they're referred or they refer themselves to our program, and I help them through all the way until they actually start our program and once they're enrolled. So I first start by helping them navigate through the Medicaid world. That can be really overwhelming for individuals trying to apply for Medicaid on their own. So normally I would go into their home, help them gather paperwork, but due to the precautions that COVID-19 has brought on, we're able to get a lot more creative. So for some folks, that's setting paperwork outside when they see me pull in the driveway. Some seniors are even learning how to use the camera on their phones and sending them to our secure email. I'm facilitating a lot of three-way phone calls. So the goal being, we will still help you get Medicaid so you can enroll into our program. So once we have tackled that Medicaid hurdle, we then start to do our assessments with the participant using remote technology, over the phone, Zoom, FaceTime if they have a family member that can help them with that. And we just navigate in all the services that we provide that Connie spoke about. We assess which ones they're going to need. And then really, I get their medical information, pass it off to the team, and we come up with a care plan. The participant is in agreement with that care plan or has the opportunity to change, give input, and then they enroll into our program.
For more information of PACE of Southwest Michigan, program of all-inclusive care for the elderly, you can call their phone number at 269-408-4322 or head to their website, paceswmi.org, or their Facebook page, PACE of Southwest Michigan.